Cancer is a very scary word.
We hear it every day. Either we're touched by it or we have a story of someone who's been affected by it.
It can affect anybody, whether you are wealthy or poor or educated, uneducated, everybody can be affected by cancer. As soon as they hear word cancer, everybody freezes. They think of the worst things.
It's very scary. It's kind of like a bullet hitch in the heart because it is a tough time. And you wonder a lot of times, am I going to make it? Will I be one of the ones?
Cancer is a very scary word, but we have come a long way as far as cancer is concerned. When I first came in 1986, we had only limited ability to cure cancer or even treat cancer. And then the hospital said that we need to create a cancer center.
I came here because I saw the plans for developing a cancer center.
The center itself evolved because Robert and Beverly, they were so generous and they donated this, and then they said, why don't we make this one as a cancer center?
It took 10 years, but at last we moved here in 1993. We created a very friendly atmosphere here, environment here. So when they walk in, it's not like going into some big hospital.
You forget you're getting treatment. You know, the doctors are here, you know, there's all the help you need, but the atmosphere is not like a hospital.
When the patients come to us, we treat them like our family members, not just as another patient, another number.
When a patient enters our doors at the Robert and Beverly Lewis Family Cancer Care Center, they are coming fearful. They are coming with a lot of questions and a lot of concerns. But they quickly realize that they have a team. They have a social worker and they will have a navigator.
I am here for you to guide you through that process and to get you through it. I'm that friend. You know, everyone has that friend, the doctor or the nurse, that as soon as something comes up, you're on the phone calling them, hey, what does that mean? I'm that for our patients, and I love it.
The philosophy basically here, patient comes first. How can we help them physically, emotionally, nutritionally? And that's where I think we treat them as a whole.
We are making sure that your treatment plan reflects you as a whole, not just the cancer diagnosis. We're looking at your family and how this impacts your family. We're looking at your work life and how this affects your work life. We're doing things to personalize your care, and you may not get that everywhere. Patients are getting the best care when they come here. The Cancer Center and Pomona Valley in general always have seen the importance of being up to date on the newest technology and well-versed in the latest literature for treating cancer. Pomona Valley has invested in 3D mammography, so all our outside facilities and the Breast Health Center have 3D mammography. We have a brand new infusion room. You have your doctors that are constantly on top of research and offering the best care possible. And you have a radiation department that has the latest radiation equipment. So the fact that the organization is ready and willing to support the community in this way is amazing.
We are continuously looking at ways in which we can offer additional services to our patients and their families. We do offer a free wig program for those that are undergoing chemotherapy and suffering through loss of hair. We are able to fit them here with wigs that allow them to feel beautiful.
Most of the chemotherapies, the patients have to go through a lot of side effects like nausea, vomiting, fatigue, anemia. But the one very distressing symptom for most women is hair loss.
The thought of losing my hair was probably more than I could bear at that time.
That was harder and more emotional for me than going through surgery and having reconstruction because I wanted to look normal. I wanted to feel normal. I just kind of wanted to look more like myself.
So for any patient suffering through the loss of hair, we offer a service called DigniCap.
The DigniCap is actually a cooling cap that we offer in our infusion center, and it basically constricts your hair follicles and prevents the hair from coming out. So women can actually keep their hair even though they're on chemotherapy.
When I was able to use the DigniCap here, it was a wonderful feeling to know that I was hopefully would be able to keep my hair, and I did.
We know that even through recovery, it doesn't stop once they leave the center. We welcome them back through yoga and imagery and other programs and classes that help treat them and continuously recognize that they're on a journey.
We have a robust library full of all kinds of information on all different types of cancers, where people can check out books, check out videos, and take free literature. In addition, we have our support groups and a creative journaling class that really allows patients to express their journey in a creative way.
The programs and services that we provide here at no cost to our patients and their families are the result of the generosity of the community and the endowment fund established over 25 years ago.
This cancer center with this high-tech treatments would not have happened without the generous support from the community. And we are grateful for that.
The community is very unique here. They are so loyal to our hospital here. They said, we'll bring the care here rather than go to a different center. They recognize that to provide this kind of care, we need some kind of support. And then they are the ones who come up with a lot of donations for these ones. And we are really fortunate in that way.
When you come to the Robert and Beverly Lewis Family Cancer Care Center, you are getting the same technology, the same research, the same up-to-date treatment plans as any other institution would offer you. The best part about it is that you don't have to go anywhere. You get to stay here, close to home, close to your family, where your support is. And not all communities have that. You're a patient, but we're taking you in as like you are our family, and we're here to just let you know that we're gonna take good care of you and we're with you every step of the way. And I think that's why patients are drawn to this place, because they get that home feel. It's not like they're a number, they're a person. We know them by name, we know their family, and we can really connect with them and offer them that personalized care that I think people search for when they're dealing with a cancer diagnosis.
I'm so grateful that I had my treatment here. My husband said, Barb, you can go any place you want. And I said, no, I love Pomona Valley. I want to come here. And I'm so glad I did. It's close to home. They treated me wonderfully. I just can't imagine having any better treatment or any better success than what I had here.
So it's 25 years now since we moved here. And I'm sure there will be a lot more years coming up. The center will continue providing excellent care. I'm confident about that.
I can't say enough about this cancer center. I could go on and on. It's a wonderful place. I just hope that everybody that has cancer has a place that's good to go to.